worked at Lancaster General for 10 years, and I am a lead medical technologist in the Core Lab. So my day-to-day, I help validate new tests, ensure quality, train new techs that are coming in, any students that we have, review reports for turnaround times, and be a resource for everyone in the lab to ask questions. When CPAL closed, that was a major reference lab for us, and it did do a lot of our work. Leadership came to us and said, we were thinking about doing these tests, or is this possible? Is this going to be too much of a burden to the techs to take on even more responsibility? We were able to bring that in by getting these new instrumentations and working with Dr. Pierre, our clinical chemist, and Lisa Rossi to choose which tests would benefit our patients to bring in-house, both by revenue, turnaround time, and without burdening our system.
I'm Lisa Rossi. I'm the manager of the Core Lab here at LGH. So I'm in charge of making sure the techs have what they need, whether it's supplies, whether it's instruments, whether it's staffing. Dr. Pierre was instrumental. We'd never had a clinical chemist before. In the past, the pathologist would chair one of the departments. So we had one pathologist that would chair chemistry and one that would chair hematology. And when we got a clinical chemist, she took it all on. She knows the tests inside and out. She knows which instruments we should get, which performs which test better than another. She communicates with the providers, she meets with them, and she determines what's the best test for our patients and how we can transition from what we're doing to the new tests.
The impact of the new instrumentation allowed us to bring in testing that we were not performing here before. So that definitely helped our patients by allowing their test turnaround time to be same day rather than days later.
For the nomination that we received for the core laboratory automation and expansion, we're really honored. I'm so thankful that Dr. Alela, I believe he's the one that made the nomination, did it because the staff truly deserves it. They've done amazing work in the past the whole time I've been here. The lab's been amazing.
From the ground up, our leadership really listens to us, understands not only what the hospital needs, what our patient needs, but also the technologists that are doing the work itself in the lab. And then on the ground level with our technologists, they're amazing. They care about our patients, they care about quality work. They want everything to be accurate and correct before any results would go out the door. So although in the laboratory we don't interact with patients, we only really see the tubes of blood, they know on the other end that's a person.